me, Adam Deshawn, with another video. So this video is going to be 5 tips that will help you pass nursing school exams. Now, I've given a similar video like this before, but this is going to kind of be like just really refined tips on how to pass nursing school exams, in my opinion. Now, those of you guys know I have been through nursing school many times. LPN, RN, BSN, MSN. So I know how to pass a test. So stay tuned. So the first tip I will say, you guys, I cannot stress this enough. Record your lectures. Record your lectures. Record your lectures. This is going to be so beneficial when you go back to study, if you're missing information or if you didn't really understand something, having your lectures recorded for you to refer back to will absolutely help you pass those nursing school exams. Hands down. So record those lectures. Everybody has an iPhone. Pull your iPhone out, hit record, get them lectures recorded so you can go back and listen. Now, the second tip, you need to really know what your learning style is. So know your learning style. If you're a visual learner versus, I'm sorry, you guys, they are replacing my fence outside, and they loud. So I'm sorry. But anyway, know your learning style. If you are a visual learner, going through your notes and really looking at your notes repetitively is going to help you. If you're an auditory learner, listening to the lecture will also help you. But if you're a visual and an auditory learner, maybe like recording the lecture via video will help you. But know your learning style. Know how you learn. Know if you learn things visually better versus if you hearing things helps you learn things better. So know your learning style. The third thing is take good notes. I know that should go without saying, but I cannot tell you how many times I've taken notes in nursing school and went back and said, what the fuck am I talking about? So take good notes. Don't assume that you're going to know what you're talking about. I remember there was one time we were talking about, I think we were talking about cardiac, and I put on there, rice. Huh? Rice, like rice. What am I talking about? Still to this day, I don't know what I was talking about. So take good notes. Be kind to your future self. Take good notes and explain yourself in your notes, because you're not going to remember what the fuck you were talking about last week during lecture. So take good notes, okay? The fourth thing, oh my gosh, y'all, get in study groups. Find a study group or form a study group. I cannot tell you how many times that, especially when I was in my associates program, I'm sorry, y'all, they are really out here bumping and grinding on the fence. I'm sorry. But anyway, study group. So I cannot tell you, especially during my associates program, how a study group really helped me. We got together in the library, we would bounce ideas off of each other, and something, just learning from your peers can be so much more helpful than learning from an instructor, and then sometimes some of my peers could really explain things so much better than I could explain it to myself, or the instructors explained it. So this forming a study group, getting into a study group was so helpful when it came time for the exam, okay? The fifth thing is learn after you've been studying this material for a while. You can't just know factual information. In nursing, you've got to apply it. So learn to apply it. Learn to ask yourselves very complex questions. It's not good enough to know that a high blood pressure is 150/95, but you need to put these things into clinical settings. Now, this is going to have to be at the end, because you got to have a really good wealth of knowledge before you can actually clinically apply this information that you've learned. But ask yourself those NCLEX type questions. Don't just know that let's say a person's blood pressure, don't just know that a blood pressure that's 80/60 or 80/50 is a low blood pressure. Think about what are the symptoms of low blood pressure. Nausea sometimes, a weak pulse. Some patients become dizzy with standing. So know those surrounding information that will help you really get a deeper understanding, because they're not going to ask you, hey, is low blood pressure is 80/50 true or false? you've got to have a really good understanding about this knowledge when you're taking these nursing exams, because it's about critical thinking. Because as a nurse, you're critically thinking. It's about critical thinking. And that's all, you guys. Follow me on Instagram at Adam Deshawn if you have not already done so. Please like and subscribe this video if you are loving this content. Hit the notification bell, because like I don't understand how I have like almost like 4,500 subscribers, but only like 200-300 y'all see my videos. How is that? How does that work? YouTube, at YouTube, how does that work? Okay, all right, I'll see you guys in the next one. Happy nursing. Bye.